Greetings again to everyone. This is Doc Cherry, Doctor of Physical Therapy. If you're new here in my channel, please don't forget to click the subscribe and the bell button below so you will become a part of our community and you will receive weekly health videos that will benefit our beloved seniors, you, and your family. Low back pain is very common, and although there are many causes of low back pain, one common cause is due to a herniated disc. In this video, you will understand what a herniated disc is, its causes, its associated symptoms, and the things that you can do at home to conservatively manage your symptoms. Your spine is made up of 24 bones or vertebra. Each vertebra is connected to each other and it forms what we call as your spinal canal, wherein your spinal cord passes. Your spinal cord is very important since it controls the motor and sensory functions in all parts of your body. In between each vertebra is your intervertebral disc. Your intervertebral disc serves as a shock absorber for your spine. And this intervertebral disc has two components: the inner layer, which we call as the nucleus pulposus, and the outer layer, which is called the annulus fibrosus. This herniation happens when these two components of your intervertebral disc extends far beyond its normal borders. This herniation can be due to aging because over time, our intervertebral disc loses its water content. In fact, that is the reason why disc herniation is common for those 30 years old above. This can also be due to trauma, repetitive prolonged sitting, and repetitive wrong posture. The most common site of disc herniation usually happens between your 4th and your 5th lumbar spine or in your lower back, and then followed by your neck region. Common symptoms that you're going to feel would include low back pain and sometimes numbness and tingling sensation if the disc herniation is severe enough to compress your spinal nerve roots. Symptoms may also include muscular weakness and loss of reflexes. The symptoms that you feel depends upon the stage of the disc herniation. We have 4 stages, namely degeneration, prolapse, extrusion, and then we have lastly sequestration. Stage 1 and stage 2 are considered incomplete disc herniation, and stage 3 and stage 4 are considered complete herniation. You need to have yourself checked immediately when you notice weakness on both sides of your legs, because usually this only affects one side of your body. If you have weakness, if you have difficulty standing or walking, or if you lose sensation when you urinate or when you defecate. Past medical history is also very important. Be sure to report to your doctor any past history of trauma or accidents. Upon examination, we usually do straight leg test, wherein we ask you to lie down, your knees extended, and your hip is flexed. If in this position, the symptoms becomes worse or there is aggravation of your pain, this may be a probable diagnosis of disc herniation. X-ray is very important, especially if you had incurred trauma or any accident, but usually MRI or CT scan is really the best choice for us to really view the extent and the exact stage of the disc herniation. An X-ray would be helpful to rule out any fracture of the spine should you had an accident, but an MRI or CT scan is best for us to really see the extent and the stage of the disc herniation. Conservative management for disc herniation would include physical therapy. If you missed out on my video regarding low back pain, you can click it here. Be sure to do the extension exercises shown in this video because you need to understand that not all back exercises would be good for you. With disc herniation, you want to avoid any position or activities that would require you to flex your back. What is recommended for you is to put the spine in extension, and that's the reason why regularly doing these extension exercises will make you feel better. If conservative management fails, steroid injection and surgery are the option. But after surgery, you are still recommended to go through physical therapy rehabilitation to strengthen the muscles of your back and to help you to be independent again in doing usual activities of daily living. The changes that one should go through with a diagnosis of disc herniation is not easy. Sometimes some of my patients will not be able to return back to work, especially if their work would instill positions that would aggravate their symptoms. That's why it is very important for you to be educated on the positions that you need to avoid and positions that would make you feel better. In addition with the extension exercises that I have talked to you, consider these tips to help you manage symptoms of disc herniation conservatively at home. Number 1, always observe proper lifting techniques. If you need to pick up something from the floor, bend your knees and not your hips because it will give you low back pain. Number 2, always avoid prolonged sitting. Number 3, avoid twisting your back. Instead, take small steps every time you turn. Number 4, observe proper posture when sitting and standing. Always aim that your ear should be always at the level of your shoulder. Thank you very much for watching. I hope that you find this video helpful. Should you have any questions regarding low back pain or disc herniation or any topics that I might be able to help you with, please comment down below because I would really get back on you. Please share this video to your friends and your family members so that we would be able to reach out and help more people. This is again Doc Sherry. Stay safe, stay healthy. God bless you.